Hi, my name is Dr. D, and I'm here to answer a few common questions about stem cell therapy. Forest Acres WellCare is now going to start providing stem cell therapy. One of the first questions is, what are stem cells? So stem cells are undifferentiated cells that come from the body that have the ability to form and become any other cell that it's immersed in. Undifferentiated cells, meaning they're just cells that are able to multiply and become more stem cells, more undifferentiated cells, until they are served a task. A task being a tissue that it is immersed in to heal and generate and become that tissue. So, what is stem cell therapy? Stem cell therapy is the art of placing stem cells in degenerated tissue and injured tissue to reformulate new growth, new tissue, and regenerate that tissue. A lot of people are using stem cells for joint replacements. Now, you're not replacing the joint, you're regrowing the joint's viable tissue. So if you have arthritis and degeneration in the knee or arthritis and degeneration in the hip, the stem cells would be placed in and become the already degenerated tissue that it's immersed in, because they're going to become new tissue, they're going to heal and generate all new meniscal, cartilaginous tissue, any of the sort within the joint that normally your body could not heal and could not repair. That's the whole point of the stem cell therapy, is so that your body can regrow and heal itself and use its own proper functioning, rather than later on down the road have to replace the entire joint and spend money on a surgery, long time of healing, have a whole new joint, things like that. Why do we use placental stem cells? The reason why that we use placental stem cells is because they are brand new viable cells that are able to rejuvenate and replace and replenish and regrow much faster than older stem cells. When you were a child and you got hurt versus when you're an adult and you get hurt, the amount of time it takes you to heal is unprecedented. So we use embryonic stem cells because they have the most rejuvenative viability. And those stem cells are all taken from planned C-section embryonic sacs. And those donated stem cells become the viable stem cells in which you will use within your own body. And you can actually trace back all the way to the original donor if you so choose. I'm Dr. D, and if you have any more questions, I will be sure to answer them. And I will be posting many more videos discussing stem cells, discussing other forms of health, discussing chiropractic, and more videos discussing health and wellness. I will also be using stem cell therapy myself. I've had degeneration in my knee. I had a knee surgery about 10 years ago, and they took out about 25% of my meniscus on the medial side. And I will actually be using stem cells to replace some of that tissue. And I will be documenting and filming my entire process of using the stem cell therapy and what it has done for me. Please follow along.